Hello and welcome to episode 39 of Tom's Hirschsprung's podcast. I've got something a little bit different to bring you today. Today I've got Charlotte with me and we are going to talk about a variety of different conditions, every single one of them you have. So we are going to talk about a variety of things, some that we brought up before, some that we maybe haven't, some that you know, some that you may not know. But welcome to the podcast, Charlotte.
Thank you.
No problem at all. Now, we'll go straight into it. You are a biomedical science master's student, having just recently graduated this summer.
Yeah.
Just first of all, before we dive into the medical conditions, was there anything in particular that made you want to do that?
I think, to be honest, it was really growing up with all the medical conditions that nobody had heard of. It was just kind of thinking, well, if nobody else has been able to do some research into those things, maybe I can do that myself. We learned that in the chronic illness conditions. If anyone can't do anything to help you, you help yourself. So that's what I've done.
Fantastic. That's as good a reason as any. And definitely having, and we will talk about all of your conditions in a bit. But you definitely had a head start on knowing what's what. That I presume everybody else.
A lot of experience just learning along the way through all the hospital appointments and all the things that can go wrong. You start to learn how different things work and how you can start to fix them.
Fantastic. Now, I'll just start off. I know you wrote a big long list of the conditions, and we were talking off air briefly about the form that I send through that for people to fill in so that I know, roughly what you have and what you want to talk about, don't want to talk about, and the little section that I leave for what's your medical condition is just not big enough for you.
Yeah, I've got quite a lot. I'm just collecting them. Some people collect stamps and pretty stones. I'm just collecting all the chronic health conditions that can go wrong.
That's
just keep it entertaining. Sometimes there'll be new ones that not even I've heard of, and they'll be like, that's what's going on there.
Well, that keeps you on your toes, I guess.
Exactly. It's always entertaining. At least I can never get bored.
Very true. Very true. We'll explain each one in turn. I think that's probably the best way of doing this. But if I just list them, so there's EDS, POTS, MCAS, endo, cPTSD.
Yep.
And that's it, I believe. We'll go through them in sort of order. We'll explain what they are, when you were diagnosed with them.
Yeah.
And we'll start with Ehlers-Danlos syndrome. Have I got that right?
Ehlers-Danlos syndrome, yeah, very close. The one that's hard to pronounce. That's the one that I was born with, and it's to do with a collagen mutation that they'd never really been able to identify before. So they were kind of like, you have to pay for the genetic test because we don't know we can actually find anything. So I don't know specifically what mutation I'm blaming for this, but all my collagen is a bit rubbish. That's the polite way of putting it. Lots of expletives tend to be involved some mornings when all my joints are dislocated, but we look for politer phrases. Keeps me entertained, dislocating joints, organs that don't tend to work quite as well, and all the sort of inability to maintain blood pressure keeps it very exciting.
And I'm right in saying you were born with this?
Yeah, definitely. I was born as a teeny tiny baby, and they were like, well, they never noticed. It took 17 years to get the diagnosis, but they really should have noticed very early on because I had all the symptoms. But of course, I was a teenage girl complaining about pain for a while, and they were like, it's definitely growing pains. Don't worry about it. And then they actually watched my hip dislocate and then watched my bones fracture, and they were like, okay, maybe there is something going on here. It was the snapping tendon that was entertaining for me. And when I said, okay, when there's a snapping tendon, I'll show you what I actually mean when I said that. And then they were like, oh, that is actually a snapping tendon. So your bones and you're moving completely differently. We need to get a video MRI of that. And then suddenly it was, okay, let's get a diagnosis for that.
Wow. Where did you
get a diagnosis if you're entertaining?
Yeah, absolutely. Where where did you snap a tendon? What part of your...
Oh, it's sort of like just over the top of your hip. It's called the gluteal tendon, and sort of the ITB, the iliotibial band that joins your knee to your hip. So that sort of normally would move in one direction, but when your tendons start to snap, they move like over the top of the bone and get wedged in between the bones, and then can just behave in completely different ways.
Wow. And from what I know about snapping tendons, and from what I can remember from my sports science degree, if the tendon in sort of the lower ankle snaps, it can sound like a gunshot. Is that
they sound like gunshot.
Okay, so is that
Right.
Do you know if that's the same with all tendons, or is that just...
Well, mine all snap all up my arms, and you can kind of hear like the little pop and this sort of sound of a gunshot. It's kind of, particularly in hips, they will be the loudest because there's more space to actually echo around. But the ankles are teeny tiny, and they can be like a little teeny tiny pistol shot.
Oh, so not as loud.
Not as loud, but cute.
Wow. Yeah, no, it's just dredging that back from sort of 10, 15 years ago.
But it's impressive being able to remember that that's the thing that stuck with you.
Yeah, well, I had to remember a lot of things.
Yeah.
Pass a few degrees, but so from what I understand is you spoke a little bit about hypermobility, but also the skin as well can be very stretchy and bendy and all sorts.
Tears so very easily.
Oh, is it just thinner as well?
Yeah, it's kind of like, sort of like wet tissue paper is how I'd describe it. So normal people's skin is meant to be like that sort of fairly solid barrier that can provide that protection to everything that's beneath it. But when you've got EDS, it just tends to be a bit more easy to tear, and occasionally will just stretch beyond belief.
Wow. Okay. So is there anything that you can do to sort of help sort of fragility?
Well, sometimes it's just sort of being able to protect your skin. And the one positive that we always celebrate is the skin doesn't wrinkle. So people with EDS never tend to look old. That's the celebration. We can have all the negatives, but we look, at least when I'm old, I won't look quite as old as I actually am. That's the main thing.
You'll still look 21 at every age.
That's
fantastic. That's fantastic. I'm really glad to know, because there are positives to EDS.
Definitely. It's harder to find at the start, but you always tend to think about them when you need them.
No, that was brilliant. Well, this podcast is all about positivity around chronic illness. So I am glad to know that there is at least one thing.
Very good. And the flexibility is always good. Sometimes it's a nightmare if you're dislocating joints, but at least you can reach things that a lot of people can't, and you can bend and open doors with your foot if you need.
Oh, wow. I bet there's some party tricks there, I imagine.
Oh, definitely. A lot of party tricks. If you've got full arms and you're thinking the door handle's too high to be able to reach it with your face, you can do it with your foot. That's the advantage.
No way. Oh, dearie me.
You can't turn the light switch on because you've got stuff in your hands. You can again use your foot. That's the advantage of hypermobility.
Fantastic. Oh, so many, many positives.
Many positives. There's lots of delightful things about all of these conditions. Lots of slight problems, I think it's fair to say, but we've got to focus on the occasional positives that bring us some joy.
Absolutely. I totally agree.
It's worth laughing about it. At least it's hilarious.
Yes. It's good to see the positive side. The other part I'm also going to bring up as well is EDS has 13 types. Well. Are you a particular type, or are you a bunch of types?
Without the sort of mutation to actually confirm it, they never specifically say that. A lot of the people that have diagnosed me and looked at me say that they think it's going to be classical type, but they just can't say specifically without the actual mutation to say it's definitely this one. As it's relating to which type of collagen is mutated and sort of how it affects you. So sort of like the classical one tends to be more relating to like hips and shoulder joints and skin, and sometimes like sort of kidneys can tend to be a bit more dodgy in the classical type. But there's lots of other types that have the same issues just at different times of life. So sometimes they're not as different as some people like think, but equally they are. It's worth knowing the differences because they can have different risks for different joints and different particular organs that will go wrong.
Wow. So it's a lot of sort of mutation of collagen.
Yeah, and it's that kind of the thing that's lacking in the research. It's being able to actually explain the differences to people and help people to understand why it's important to understand the differences. But of course, doctors will go, you have EDS, that's all I need to know. But EDS doesn't really tell them as much as actually knowing the type.
Yeah.
It makes a difference.
No, very much so. And in terms of, because obviously you've had this all of your life, in terms of having to sort of explain it to people, kind of like I've had to do with Hirschsprungs and trying to get it to a couple of sentences is really tough.
It's really challenging. It's your whole life and it affects everything, but you can't condense it into a couple of sentences.
No. But so how have you managed to sort of, when you had to explain it to people, have you had to take the sort of long-winded approach, or have you managed to sort of say, well, it's kind of like hypermobility, but a bit more there?
Yeah, I suppose I tend to shorten it to some of the joys and some of the negatives in the same sentence and just go, well, it's mainly the bendy joints and I can break my bones very easily and it keeps my blood pressure very unstable, but at least I can reach things you can't and bend backwards rather than breaking straight away.
Fantastic. 2 sentences. Perfect. There we go. You saw
But then you inevitably get follow-up questions about all of that, don't you?
Yeah, that's very true. That's very true. But in this instance, because we've already talked about it, I have no follow-up questions.
Oh, thanks.
I'd like to, if I may, move on to POTS, which is, for those who are unaware, postural tachycardia syndrome. Now, this is something I really want to talk to you about because this is something literally closer to my heart. So, because as I've put in my story, that's my pin post on Instagram, I had tachycardia.
Yeah.
When I was a baby.
Yeah.
And again, those who are unaware of tachycardia, where the heart is beating very, very, very fast. And obviously it's very, very dangerous for that.
Yeah.
Mine was mainly down to blood poisoning. And then eventually was stopped through magnesium. So a shot of magnesium in the bloodstream, and then it sort of sorted itself out from there.
Wow.
But postural tachycardia syndrome is different to that, isn't it?
Yeah, kind of. It's sort of more lifelong. So if you've got your inability to sort of maintain a stable heart rate and an inability to maintain stable blood pressure tends to be the cause in EDS. Some people, it tends to be post-viral and it can just be as a result of that sort of inflammation, a bit of nerve damage and not being able to regulate the heart rate. But for me, it's just inability to maintain anything stably just because my body is not really designed to be stable. I think it's built by idiots, I think is the polite way of putting it. But I'm not criticising my parents on a podcast. I love them.
No, it's just can be the way, isn't it? I mean, it's like a lot of things. It's not necessarily sure how we get these illnesses. They just tend to happen. Did they ever give you sort of a because with Hirschsprungs they give a sort of 1 in 5,000. Did they ever give you like your 1 in X amount?
Well, I think there's sort of, they don't know because they said that EDS was rare. But then, of course, there's been more and more people that they're finding and just going, okay, it was rare that you got diagnosed. In reality, it's not looking quite as rare as it once was. And equally, the POTS post-COVID with all the pandemic stuff, it's been really quite common post-viral, and long COVID, they're relating bits of it to POTS. So I think sometimes they say at the start they'll give you a number, but of course that'll change in a few years as they get more aware of how many there's going to actually be.
No, that makes absolute sense.
Yeah.
Absolute sense. So part of POTS obviously is dizziness, lightheadedness, chest pains and fainting. So all the joys.
All the joys.
But so do you have to, again, do anything specific for that, sort of standing up too quickly and things like that?
Yeah, well, they recommend basically if you stand up, just cross your legs before you stand up, because that can raise your blood pressure by about +7. And you think it won't make a huge difference, but when you start doing it all the time, you realise it does make a difference.
Oh, I didn't know that.
Yeah, it's one of those interesting little tricks that is very, very simple, but equally when you actually need to go to pee, you actually increase your blood pressure by about 5. So they say sometimes that if you want to go anywhere, it's best to need the toilet at the same time.
Drink lots of water. Yeah.
Yes, definitely.
Wow,
Salt tablets and heart meds will also help to settle the risk of all the sort of high heart rate and that sort of risk of fainting, which is great. But it's one of those things that, again, people still don't know how to actually solve.
No, yeah. Possibly may never do so. But
yes, definitely.
But that's, again, a reason I love doing this podcast is as well to get them out to everybody, so lots of people learn about various conditions, but also so I learn as well. I love learning little facts like that about the crossing of the legs, and it's a sort of +7. Do you say +7?
Yeah, +7 on the blood pressure. So systolic can go up by about 7, which makes a difference.
Yeah, hugely. Absolutely. No, I love learning little facts like that. This will make this a lot of fun. But I do want to touch on, before I go on to the other medical conditions that have taken up a whole page of my notes. With having POTS, you do a lot of exercise, a lot of cycling. And one thing that you have done is a 500-mile bike ride in 2 weeks?
Yeah.
Yes, you did that. So how did you manage? Did you have to do anything specific to manage POTS for that?
Well, I think the advantage of cycling is one of the reasons I chose it is because it's a seated sport. There's slightly less risk of having POTS being too much of a problem because you don't necessarily have to stand up. It's getting off the bike and walking away at the end of the cycle that's the challenge, because once you're upright again, it's, oh dear, bye-bye blood pressure. But I think I managed by drinking extra water, taking extra salt tablets, getting extra infusions with their sort of saline, just normal saline infusions tend to help with the POTS, and they tend to recommend that for athletes after long runs and cycles. And with POTS, they recommend at least once a month, I think at the moment they're saying is the sort of recommended time frame for the infusions. And they helped and kept me going.
Fantastic. And do you remember how much you raised for EDS?
I think it was £1,360.
Wow, that's fantastic for a couple of, and you did those over 500 miles over a couple of weeks.
Yeah, I think it was maybe a month for the 500-mile one, and I think it was 2 weeks for the 250-mile one, and then I did like 231 hours because that was the number of days I'd had PIP. Was sort of 231 hours of exercise over like 6 weeks, I think it was in the end. It always keeps me entertained. Most of it's distraction. When you live with these chronic conditions that cause pain, it's always good to have a distraction and a reason to be thinking, well, that's going to make a difference today, and that's what matters.
No, totally agree with that. And one more fundraising effort that you did was for the Trussell Trust. A little bit more about that?
Yeah, that was a recent one. It was just after getting out of hospital. And because I'd had to go 6 months without food, just mainly because the doctors were a bit of an idiot. And I just thought, I don't want to see other people struggling for food just purely because of money, because that's the heartbreaking thing. I knew for me, I had no choice because I needed drugs that they wouldn't give me. But other people are struggling the same way that I did, and they're still not getting help. And I knew how hard that was. So I just thought, I want to fundraise for the Trussell Trust and make a difference to try and help people that are struggling to get the money for food.
Fantastic. And that was 800 miles of running?
Yeah, running and cycling. It was a combination. I just thought sort of 800 miles of exercise, and I think mainly cycling, but a few running as well. And it kept me very entertained for quite a long time.
And that's over a year as well. So did you do that from like a January to December thing, or was it?
It was like a 6 weeks. sort of time frame, but it just felt like a lot longer. It's kind of hard to remember, but it was only a year ago, but I was still recovering from the sort of the brain damagey stuff, so it was a bit like hard to remember all the details, but I just remember getting up every day and exercising, and most of it was just to help build the muscle back, and it was really, really helping for that.
Yeah, no, fantastic. No, thank you very much for that. And well done on your fundraising efforts. That's fantastic. I'm all for exercise-based fundraising efforts. And in fact, actually coming up for Hirschsprung's Awareness Month, there will be a fundraising effort. I said that I would mention this to the person who is doing this, so this seems like a fantastic segue. But there is a group, person called Vicky Bignell, who I know through Facebook. She messages me, and she is raising money for Guts UK.
Wow.
Aiming to reach a combined group effort of 5,000 kilometres in September via walking, cycling, or running. Really, just sort of any exercise, and looking to raise money there. So if you are interested in supporting that, Vicky Bignell's Facebook page, I think she's going to start putting it out all over the place. But yes, I said that I'd advertised that for her. So
congratulations to them. It's lovely.
Hopefully that will be for September. So yes.
Wow.
Yes, we're raising money and raising awareness.
Yeah. It's amazing being able to do a challenge that relates in some way, but doesn't necessarily feel like it's all consuming about the condition.
Yes, and I'm all for exercise-based challenges. I think. Well, I tend to be one of those people who does exercise anyway. So if you can do it and help as well, then
exactly,
I'm all for those. Those. But back to you and your list of go down the list of chronic conditions.
We have a break. It makes it feel a bit less all-consuming with all the list of conditions.
True. But number 3,
is that the MCAS one?
MCAS, yes. So mast cell activation syndrome. So is this another cardiovascular one?
This one's the immune system one. So it's relating to mast cells in your immune system that normally would deal with allergic reactions. So that's the reason that a lot of people tend to know them. If they have an allergy, they'll know the mast cells are the evil thing. They're brain for that. So normally they will be sort of chilling in your immune system, but they will be able to release histamine to deal with allergies. But normally the dealing with allergies, you think dealing with allergies would imply support, but of course anaphylactic shock is definitely not support. It's not a good idea.
No, definitely not.
It's to lead to the very, very dangerous situation of just lots of histamine, and then your heart will start to really struggle with the amount of inflammation in your body.
Yes. That's but that's sort of probably one of your more easier to explain.
Yeah. More people relate to the idea of just don't eat those foods, but when it is literally all foods, with the exception of I've got it up to about 130 foods now that I can eat, which is brilliant. But of course, then you realise when you start counting them that there's a heck of a lot of foods that are just definite anaphylactic shock avoid.
But I guess if you focus on the 130, it sounds like you got loads of variety.
Exactly. Got lentils. When I figured out I could eat lentils, that was the biggest game changer, because lentils are brilliant.
So is that 100?
Anything with lentils.
You can. That's very true. And is that 100? I presume that's 130 different foods. That's just not like 130 different types of cheese or something.
Well, 130 different foods, but I'm including like herbs and occasional bits of spices in there. So some of them are not actual foods on their own, but at least help to make foods better.
True. Very true. And another part that I wanted to talk to you about was endometriosis, because someone that we both know who came on the podcast a few weeks ago, Rebecca Johnson-Richards, episode 33, if you haven't checked that one out, has endo, and we talked for quite a while about endometriosis and just how common it is. One in 10 women suffer with endometriosis.
Yeah.
And something that, and it might just be my ignorance, but I hadn't heard a great deal about it. And I certainly...
Not just you, there really isn't the research to actually evidence it. I mean, I did an infographic recently on my Instagram about how little research is actually published. I think it was well under, like a couple of hundred, that is actually being published looking at endometriosis and how to solve it.
Yeah. I mean, I've seen things that are far rarer.
Yeah.
Endo, and get so much more coverage.
Yeah.
Why? I guess I'll ask this question. You might not know the answer, but I'll ask it anyway. But why do you think that is?
No, I mean, I'm told a lot of the time it's maybe just because endometriosis is something that only people with the uterus would suffer with. And of course, a lot of research tends to be primarily centered around just men, just because in reality, in history, it was only men doing the research. And now, at least I'm getting to be one of the people that can actually start to do research into these conditions. But there hasn't been a lot of research conducted by women for purely women's conditions, and it makes a difference.
That's interesting. I hadn't thought of it that way, but actually that does make quite a bit of sense.
The obvious go-tos, and sadly it is still a bit of a reason that a lot of conditions that just wouldn't get the research purely based on the fact that there just isn't the money, because mostly money is coming from people that have money, and the governments tend to not be very supportive of all the things that they're not suffering with themselves.
That is, yeah. I mean, but that's go down the list of illnesses, especially chronic illnesses. I mean, one of the more obvious ones is, if a celebrity has that condition or their child has that condition, you're going to hear more about it, hear more awareness about it. And I think sometimes that's just the way of the world.
I suppose it's not one of those conditions that people want to talk about all day, every day, because inevitably it's a topic that still is quite just dismissed as not a topic to talk about by most people. Like, a lot of the things that relate to any kind of organ sometimes just tends to get like, we don't want to talk about that. Like a lot of IBD have the same sort of problem. Nobody wants to talk about anything relating to the gut. You don't want to be talking about that at various times.
Yeah. Probably why no one ever started a Hirschsprung's podcast about it. There's plenty of IBD.
Thankfully you did, and we're all grateful.
I did eventually. It took me 32 years, but I got round to it eventually.
But it makes a difference now, and that's all that matters.
It's very kind. Very kind. And as I sort of go down to another condition you have, which is PTSD, but it's slightly different in terms of cPTSD. Complex post-traumatic stress disorder. What makes the difference between PTSD? Because I think everybody listening to this will have heard of some form or other of PTSD, but what becomes the difference between that and making it complex?
No, they've never really bothered to explain it to me in detail, but I suppose it's one of those things that they just, if maybe that it's relating to just how you present. I suppose if there's a couple of features that are slightly different, and being able to have lots of history of a fair amount of trauma, I think maybe is the sort of reason that you've got a few more interlinked traumas that tend to just build up to this slightly bigger not inability to cope with it now, but just slightly more difficult to separate any challenge now from anything that happened in the past.
Okay. Yeah, that makes sense. Yeah, I just had a look at that and I thought, well, I think, I've heard of PTSD, but I hadn't really, I just thought PTSD was PTSD. It obviously it can manifest itself in several different ways, but never heard it called complex. And again, that might just be my ignorance again.
No,
but
it's again one of those topics that people don't talk about in as much detail as they should. I mean, you hear the word PTSD used quite a lot, just repeatedly through either TV or films, but then actually being able to explain what it's actually like for people in different cases is quite important, because you only tend to see it relating to war stories or those kind of things, but you don't ever tend to hear the more common thing when it's looking back to what's happened in hospital for a lot of people with chronic illnesses that would be able to be like, yeah, that's why I don't go near that building. That's why I can't see that person without shaking. That's why I can't actually talk and use those words that I used at the time without just shaking incessantly.
Yeah. No, I think that's something that's not honestly talked about enough. I know I've talked on this podcast to quite a few people who, whether they've been diagnosed with it specifically or not, but certainly suffer with a form of trauma, having to, and sort of talking about their condition and what procedures they went through are quite difficult.
Yeah, I suppose the main sort of difference between general PTSD and the complex thing is just the sort of length of time when you've got that sort of trauma that's very instant, and like often with the sort of the war traumas that people come back with, they tend to be more relating to actual cPTSD because the trauma was longer and went on for that longer period of time, and you get that sort of just longer period of time to be so stressed about something and be focused on something. So when you try and actually look at something else, it's inevitably harder to look at something else because there wasn't a lot else going on at the time.
Yeah, no, and it's definitely something that I will want to investigate a lot more, and certainly I'll do that by my own research and by talking to people like you, and just finding out a little bit more about it, because I think to a certain extent, and again, I'm not a doctor, don't take my word for it, but to a certain extent, we all have a little bit of trauma, those who've gone through chronic illness and from various operations. I know
definitely.
And whether we accept it as trauma, whether we call it something else, and also, people have different levels of it, but I think there is definitely something there. And again, not a doctor, don't take my medical advice, but
to be honest, you seem a lot nicer than a doctor, so I'm very grateful that you're not a doctor.
And a lot less intelligent.
No, doctors would never be described as intelligent, and I'm sure most people in the chronic illness community can relate to that. You meet doctors and you definitely wouldn't describe them as intelligent.
Right, so we'll move on from that point. On to sort of your sort of surgeries, treatments, and one thing we haven't mentioned is pyloric stenosis.
Yeah.
Again, something you're diagnosed with at birth. Because why be diagnosed with one when you can be diagnosed with two?
Yeah.
So, and that was that immediate surgery from there?
It was when I was about 2 weeks old. I think because I was a bit prem, they had to wait for a bit longer. I might have been a bit older than that, but it was because I couldn't actually eat anything without projectile vomiting. So there was inevitably quite the urgent need to do something about that. And they didn't recognise it at first because it tends to be more common in boys, and they've never really been able to explain why. But apparently some research into EDS now is saying that actually they think that if you have EDS, that it seems to make it a bit more split 50-50 between girls and boys, and they still don't know why, but they just think it seems to be a bit more of an even split.
But that kind of brings on to the point that you said before about things becoming less rare now that more people are diagnosed with them. And again, it might just be a case of being, because it's diagnosed more, obviously then you're going to find potentially that more boys and girls condition.
And you actually start to notice actual links that you can find.
Yes. And I guess as science moves on, and would hopefully it'll be possibly easier, less stressful to diagnose, and
hopefully.
From there.
It was just a junior doctor that came in and saw me and just saw my frown, and she said, "I've seen that frown before. I know that frown. That's the frown of a pyloric baby." And it was something as simple as my eyebrows were creased in a slightly different way, and they were like, "That's pyloric stenosis." So they did a scan, and they were like, "Yep, that's definitely pyloric stenosis."
That's incredible. They just pulled that from the frown face.
Yep. And she was a junior doctor, so inevitably people didn't listen to her at first, but they decided to do the test, and then they were like, she's right.
Yeah, I am all for junior doctors. Again, anybody who knows my story will know that I was saved by a junior doctor, and a piece of information that I sort of mentioned previously about the shot of magnesium to help with tachycardia. So
I tend to be a bit more prepared to try something new and recognise when we don't know something, we need to try something.
Potentially they have, because they are still training, learning, still in lectures and up to date with all of the new science that's going on. So I will back junior doctors to the hilt. I always. So yes. Any junior doctors that are listening, we love junior doctors on the host.
Yeah, definitely.
Absolutely love them.
Just
so
nice. If I'm allowed to say that.
I do. Yeah, I'd say what you want. It's fine. It's only sponsors and radio stations we have to worry about. It's okay.
Oh, okay, yeah.
But yes, so back onto treatments and surgeries. Steroids as well.
Yeah.
MCAS. And the EDS as well, I know we mentioned previously. A lot of physio and osteopath.
Yeah.
Going to see the osteopath and deep tissue therapy. Is that all for the skin, or is that for hypermobility?
Mostly for the muscles, and some of the sort of like the osteopathies for the sort of structural bone stuff. Occasionally, normal people can get like dislocated spine or slightly twisted spine, but it tends to be a bit more like rare after something really big that's gone on. But for me, it tends to sort of be like every other week I'll dislocate or twist my spine in a place and just need to get it fixed. And it's worth trying to get fixed sooner rather than later.
Very true. Very true. And so we talked a little bit about, things like reaching for door handles, whatnot. You have a lot of interests and topics. And one of your main interests is walking your dog. So obviously something that's going to be, is that trickier with your conditions, or does it not make too much of a difference?
I mean, it can be trickier. And I mean, some days it's one of those things that can be a real challenge, and that's occasionally something that's hard, because the dog is a thing that you love with all your heart and you want to be able to make happy all the time, and the idea that you can't do something that really matters to them is the hardest thing. I mean, there's lots of challenges, but the idea of not being able to take her for a favourite walk, that's the saddest thing. But she's being the most supportive dog. She knows, like, she won't pull me down a hill. She knows that I have to walk down a hill slowly. So she will stop and wait and just trot very carefully down the hill.
That's so intuitive. Oh, that's so intelligent.
Yes.
Fantastic. I mean,
and if I stop and say ow, she will just stop and look at me, and she'll then see if I need a hug, and she'll run back to me and give me a little puppy cuddle.
Wow, that's amazing. Oh, what's the name of your dog?
She's called Pip. She's a little pipsqueak, quite literally.
Oh, she's a very small dog?
She's a tiny dog. She's a Shih Tzu.
Oh, lovely. How old?
She's nearly 3.5 now.
Oh, fantastic. Oh, nice. I love hearing stories like that. And again, anybody who's listened to this podcast for for a number of episodes will know that dogs are very, very special to a lot of my guests and to me as well. So I look after Span.
Dogs are the best creature in the world.
Yes, they're fantastic. Absolutely fantastic. But yes, thank you so much for sharing that story. Because always like to hear good dog stories, and any good dog stories are always welcome on the podcast.
She always knows when I need a little bit of puppy support. She'll come up to me and just curl up next to me, and it's like, yeah, you can stay there for the rest of your life, but now I can't move. When the dog's snoring across your knee, that means you're stuck there for as long as the dog's asleep.
Yes, yeah, don't you dare move. Otherwise, no, don't move. Absolutely. Oh, that's fantastic. That's so good to hear. And just as we sort of wrap towards the end, I'd like to know from you, because obviously we've gone a lot through various medical conditions, and I've learned so much from you. So thank you so much for that. And you have just graduated from your biomedical studies.
Yeah.
What would you like to do with that in the future?
I would love to be able to research all these chronic conditions that affect us all and make us feel, just make life harder. And I want to be able to make a difference for that. That's the thing I want to focus on. I want to be able to make a difference when people have told me that we can't do anything. I want to change that.
That's brilliant. No, I love that. I really do. And was that sort of any specific age group that you want to work with, elderly or children or...
Just generally looking at cells and molecules throughout everyone's entire life. We've been looking at some of the genetics relating to different conditions and being able to study how they impact the cells and how they start to behave differently. It's just incredible.
Brilliant. No, I do. I love that. I love that. And you're also part-time tutor as well. Is that the same?
Yeah.
Is that the same sort of teaching people about biomedicine again?
Mainly tends to be GCSE science and sort of a couple of A-level biology students and occasionally younger Key Stage 3 maths and science, and I love it. Being able to talk to people at such a young age and be able to be the supportive teacher that I wished I'd had at school. If people are struggling or missing school because they're either suffering with chronic illnesses or just they don't know what's going on yet, it's nice being able to actually help and be a supportive voice to help them and help them get the grades that they would like to get.
It's fantastic. That's incredible. That's that's absolutely brilliant, and good on you for doing that as well. And because it's quite entrepreneurial to then go out and go, right, I'll go and, because obviously you have all of this information and to then go out and go, right, I'm gonna not just focus on my own career but help other people with their careers as well, which is
always lovely to be able to help other people, not have to suffer the same things that you did.
Yeah, and that's, again, another reason why I wanted you on the podcast. So I think we're very similar in terms of we go into careers, or have always been in careers, where we help people.
Yeah, exactly.
And again, each to their own. I'm not saying that if you don't have a career where you help people, you're a nasty human being, but because each to their own. I think that sort of vocational way of work is something that I love, and I've done throughout my sort of careers as well. So
but it's making a huge difference with the podcast you've set up, being able to connect to people that might feel lonely with living with these chronic illnesses, but they don't necessarily maybe feel like they have the community around them to help them. You're creating that for them.
That's very, very kind of you to say so. But I will preface by saying that it is about guests.
Yes.
If I had no guests, I mean, we're 39 episodes deep, and I'm so grateful, because again, I don't probably say this enough, how grateful I am for the guests that come on, and because I can't talk by myself for more than 10 minutes. I tried. For anybody who's ever listened to episode 1, it is 8 minutes of 39 seconds. It felt like about 4 hours. So I can't talk for any longer than about 10 minutes by myself, so I need guests. I need guests like yourself and like the 38 people before you to come on, share their fantastic stories. And the podcast is nothing without the guests and the story. Otherwise, it would just be me talking about my same Hirschsprung stories for many, many episodes. So that's very kind of you to say so, but it is very much about the guests and about the
But
people.
it's thanks to you that you've got the guests coming to you and being able to sell their stories. So you've got to take some credit for that.
I do send a lot of messages and harangue agents and email agents over and over again for various people. So yeah, I do a lot of haranguing.
Very good to do.
But no, thank you so much for that. But yes, I've lost my train of thought now. Yes, I was saying that on your biomedical science studies, I just wanted to say thank you so much for coming on. It's been a real pleasure to talk to you. And I wish you every success in the future with your tutoring, with your biomedicine, and your chronic illnesses as well. Thank you, Charlotte. Thank you so much for coming on.
Well, thank you so much for giving me the opportunity to come on and talk.
My pleasure.